So in cancer immunotherapy, we've noticed a number of pathways that seem to mediate resistance and that have been emerging as therapeutic targets of a lot of potential. So one of them is the adenosine pathway, where we've seen over the last several years that drugs in the refractory disease setting can generate responses in some patients, albeit relatively infrequently, like 10%, 15% of the time. And recently there was a clinical trial in lung cancer moving this adenosine pathway inhibition with a CD73 inhibitor to the front line, showing a big benefit. So at SITC 21, we're showing an update for the molecule CPI-006, which is another a CD73 inhibitor. And specifically in this case, we're looking at it in the context of virally associated malignancies with HPV or COVID-19. Because what we've observed with CPI-006 is after we administer the drug, the immune cells in the peripheral circulation start to do funny things. They actually disappear for a period of time. After you give the drug, a couple of hours later, all of a sudden all the counts disappear. But within about a week, they all come back to normal. But the phenotype of the B cells especially is very different and suggests that those B cells have been educated against an antigen, and we presume that would be whatever the dominant antigen is. And so in cancer, we think that that would be the cancer, but in COVID-19, it would be the virus. And so we presented data on this poster of both of those things, which is that this molecule CPI-006 was actually started a randomized phase 3 trial in COVID-19, showing a substantial reduction in the hospitalization rate of patients, and we think that's because we're enhancing their humoral immunity to make antibodies against COVID-19. And similarly, in patients with refractory HPV-associated head and neck cancer, we're seeing responses or disease shrinkage in patients after they've already had an anti-PD-1, all consistent with this idea that this approach both would block that adenosine pathway and augment the ability of the body to make antibodies against whatever it is, the cancer in this case. And so I think it's a very exciting approach, and we'll be moving into definitive trials in the near future.